Question 1. The nurse is monitoring a client in the immediate postpartum period for signs of hemorrhage. Which sign, if noted, would be an early sign of excessive blood loss? 1. A temperature of 100.4 degrees Fahrenheit 38 degrees Celsius. 2. An increase in the pulse rate from 88 to 102 beats per minute. 3. A blood pressure change from 130/88 to 124/80 mmHg. 4. An increase in the respiratory rate from 18 to 22 breaths per minute. Explanation. Question 1. Rationale. During the 4th stage of labor, the birth parent blood pressure, pulse, and respiration should be checked every 15 minutes during the first hour. An increasing pulse is an early sign of excessive blood loss because the heart pumps faster to compensate for reduced blood volume. A slight increase in temperature is normal. The blood pressure decreases as the blood volume diminishes, but a decreased blood pressure would not be the earliest sign of hemorrhage. The respiratory rate is slightly increased from normal. Test-taking strategy. Note the strategic word, early. Think about the physiological occurrences of hemorrhage and shock and the expected findings in the postpartum period. This will assist in directing you to the correct option. Question 2. The nurse is preparing a list of self-care instructions for a postpartum client who was diagnosed with mastitis. Which instructions would be included on the list? Select all that apply. 1. Wear a supportive bra. 2. Rest during the acute phase. 3. Maintain a fluid intake of at least 3,000 milliliters per day. 4. Take the prescribed antibiotics until the soreness subsides. 5. Continue to breastfeed/chest feed if the breasts/chest are not too sore. 6. Avoid decompression of the breast/chest by breast/chest feeding or breast/chest pump. Explanation. Question 2. Rationale. Mastitis is an inflammation of the lactating breast/chest as a result of infection. Client instructions include resting during the acute phase, maintaining a fluid intake of at least 3,000 milliliters per day, if not contraindicated, and taking analgesics to relieve discomfort. Antibiotics may be prescribed and are taken until the complete prescribed course is finished. They are not stopped when the soreness subsides. Additional supportive measures include the use of moist heat or ice packs and wearing a supportive bra. Continued decompression of the breast/chest. By breast/chest feeding or breast/chest pump is important to empty the breast/chest and prevent the formation of an abscess. Test-taking strategy. Focus on the subject, treatment measures for mastitis. Think about the pathophysiology associated with mastitis to answer correctly. Recalling that supportive measures include rest, moist heat or ice packs, antibiotics, analgesics, increased fluid intake, breast/chest support, and decompression of the breast/chest will assist in answering the question. Question 3. The nurse is providing instructions about measures to prevent postpartum mastitis to a client who is breastfeeding/chest feeding the newborn. Which client statement would indicate a need for further instruction? 1. I need to breastfeed/chest feed every 2 to 3 hours. 2. I need to change the breast/chest pads frequently. 3. I need to wash my hands well before breastfeeding/chest feeding. 4. I need to wash my nipples daily with soap and water. Explanation question 3. Rationale. Mastitis is inflammation of the breast/chest as a result of infection. It generally is caused by an organism that enters through an injured area of the nipples, such as a crack or blister. Measures to prevent the development of mastitis include changing nursing pads when they are wet and avoiding continuous pressure on the breast/chest. Soap is drying and could lead to cracking of the nipples, and the client needs to be instructed to avoid using soap on the nipples. The client is taught about the importance of hand washing and the need to breast/chest feed every 2 to 3 hours. Test-taking strategy. Note the strategic words, need for further instruction. These words indicate a negative event query and the need to select the option that identifies the incorrect client statement. Recalling that the use of soap is drying to the skin and could cause cracking and provide an entry point for organisms will direct you easily to the correct option. Question 4. The postpartum nurse is assessing a client who delivered a healthy infant by cesarean section for signs and symptoms of superficial venous thrombosis. Which sign would the nurse note if superficial venous thrombosis were present? 1. Paleness of the calf area. 2. Coolness of the calf area. 3. Enlarged, hardened veins. 4. Palpable dorsalis pedis pulses. Explanation question 4. Rationale. Thrombosis of superficial veins usually is accompanied by signs and symptoms of inflammation, including swelling, redness, tenderness, and warmth of the involved extremity. It also may be possible to palpate the enlarged, hard vein. Clients sometimes experience pain when they walk. Palpable dorsalis pedis pulses are a normal finding. Test-taking strategy. Eliminate option 4 first because this is a normal and expected finding. Next, eliminate options 1 and 2 because they are comparable or alike. Question 5. A client in a postpartum unit complains of sudden sharp chest pain and dyspnea. The nurse notes that the client is tachycardic and the respiratory rate is elevated. The nurse suspects a pulmonary embolism. Which would be the initial nursing action? 1. Initiate an intravenous line. 2. Assess the client's blood pressure. 3. Prepare to administer morphine sulfate. 4. Administer oxygen, 8 to 10 L/minute, by face mask. Explanation question 5. Rationale. If pulmonary embolism is suspected, oxygen should be administered, 8 to 10 L/minute. By face mask oxygen is used to decrease hypoxia. The client also is kept on bed rest with the head of the bed slightly elevated to reduce dyspnea. Morphine sulfate may be prescribed for the client, but this would not be the initial nursing action. An intravenous line also will be required, and vital signs need to be monitored, but these actions would follow the administration of oxygen. Test-taking strategy. Note the strategic word, initial. Use the ABCs, airway, breathing, and circulation, to assist in directing you to the correct option. Question 6. The nurse is assessing a client in the 4th stage of labor and notes that the fundus is firm but that bleeding is excessive. Which would be the initial nursing action? 1. Record the findings. 2. Massage the fundus. 3. Notify the obstetrician, OB. 4. Place the client in Trendelenburg's position. Explanation question 6. Rationale. If bleeding is excessive, the cause may be laceration of the cervix or birth canal. Massaging the fundus if it is firm would not assist in controlling the bleeding. Trendelenburg's position needs to be avoided because it may interfere with cardiac and respiratory function. Although the nurse would record the findings, the initial nursing action would be to notify the OB. Test-taking strategy. Note the strategic word, initial. Focus on the data in the question, noting the clinical manifestations identified in the question. Eliminate option 2 first because if the uterus is firm, it would not be necessary to perform fundal massage. Knowing that Trendelenburg's position interferes with cardiac and respiratory function will assist in eliminating option 4. From the remaining options, noting the words bleeding is excessive will assist in directing you to the correct option. Question 7. The nurse is preparing to care for 4 assigned clients. Which client is at most risk for hemorrhage? 1. A primiparous client who delivered 4 hours ago. 2. A multiparous client who delivered 6 hours ago. 3. A multiparous client who delivered a large baby after oxytocin induction. 4. A primiparous client who delivered 6 hours ago and had epidural anesthesia. Explanation question 7. Rationale. If bleeding is excessive, the cause may be laceration of the cervix or birth canal. Massaging the fundus if it is firm would not assist in controlling the bleeding. Trendelenburg's position needs to be avoided because it may interfere with cardiac and respiratory function. Although the nurse would record the findings, the initial nursing action would be to notify the OB. Test-taking strategy. Note the strategic word, initial. Focus on the data in the question, noting the clinical manifestations identified in the question. Eliminate option 2 first because if the uterus is firm, it would not be necessary to perform fundal massage. Knowing that Trendelenburg's position interferes with cardiac and respiratory function will assist in eliminating option 4. From the remaining options, noting the words bleeding is excessive will assist in directing you to the correct option. Question 8. A postpartum client is diagnosed with cystitis. The nurse would plan for which priority action in the care of the client? 1. Providing sitz baths. 2. Encouraging fluid intake. 3. Placing ice on the perineum. 4. Monitoring hemoglobin and hematocrit levels. Explanation question 8. Rationale. Cystitis is an infection of the bladder. The client need to consume 3,000 milliliters of fluids per day. If not contraindicated, sitz baths and ice would be appropriate interventions for perineal discomfort. Hemoglobin and hematocrit levels would be monitored with hemorrhage. Test-taking strategy. Focus on the subject, measures to treat cystitis, and note the strategic word, priority. Remember that increased fluids are a priority intervention. Question 9. The nurse is monitoring a postpartum client who delivered 1 hour ago and received epidural anesthesia for delivery, for the presence of a vulvar hematoma. Which assessment finding would best indicate the presence of a hematoma? 1. Changes in vital signs. 2. Signs of heavy bruising. 3. Complaints of intense pain. 4. Complaints of a tearing sensation. Explanation question 9. Rationale. Because the client has had epidural anesthesia and is anesthetized, the client cannot feel pain, pressure, or a tearing sensation. Changes in vital signs indicate hypovolemia in an anesthetized postpartum client with vulvar hematoma. Option 2, heavy bruising, may be seen, but vital sign changes indicate hematoma caused by blood collection in the perineal tissues. Test-taking strategy. Note the strategic word, best. Also note that the client received epidural anesthesia. With this in mind, eliminate options 3 and 4. From the remaining options, use the ABCs, airway, breathing, and circulation, to direct you to the correct option. Question 10. The nurse is creating a plan of care for a postpartum client with a small vulvar hematoma. The nurse would include which specific action during the first 12 hours after delivery? 1. Encourage ambulation hourly. 2. Assess vital signs every 4 hours. 3. Measure fundal height every 4 hours. 4. Prepare an ice pack for application to the area. Explanation question 10. Rationale. A hematoma is a localized collection of blood in the tissues of the reproductive tissues after delivery. Vulvar hematoma is the most common. Application of ice reduces swelling caused by hematoma formation in the vulvar area. Options 1, 2, and 3 are not interventions that are specific to the plan of care for a client with a small vulvar hematoma. Ambulation hourly increases the risk for bleeding. Client assessment every 4 hours is too infrequent. Test-taking strategy. Focus on the subject, a small vulvar hematoma. Think about the effect of each action in the options. This focus will assist in directing you to the correct option. Question 11. On assessment of a postpartum client, the nurse notes that the uterus feels soft and boggy. The nurse would take which initial action? 1. Document the findings. 2. Elevate the client's legs. 3. Massage the fundus until it is firm. 4. Push on the uterus to assist in expressing clots. Explanation question 11. Rationale. If the uterus is not contracted firmly, i.e., it is soft and boggy, the initial intervention is to massage the fundus until it is firm and to express clots that may have accumulated in the uterus. Elevating the client's legs would not assist in managing uterine atony. Documenting the findings is an appropriate action, but is not the initial action. Pushing on an uncontracted uterus can invert the uterus and cause massive hemorrhage. Test-taking strategy. Note the strategic word, initial, in the question. Focus on the subject, that the uterus is soft and boggy. Recalling the therapeutic management for uterine atony will assist in directing you to the correct option.